You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, smile makeovers. According to my first guest, small improvements to your smile can make a big difference. We have Pittsburgh's go-to guy when you want a beautiful smile, Dr. Bartusiak. Dr. Bartusiak, welcome to the program.
Thanks for having me on the show, Randy.
All right, now, cosmetic dentist.
Yes.
But for people that don't know you, I guess you do a lot of things. Who's your typical patient, and what are the procedures you do in your office?
Our typical patient, Randy, is anybody from a toddler to a 92-year-old.
Okay.
We service all
So
aspects.
it's like a family practice?
It's a family practice.
Okay.
We welcome all ages. We take care of, mostly family members. The typical patient, if you would be mom, dad, and the kids. We have everybody from the local policeman to the steel worker to the person that works at the computer software company.
Cosmetic dentistry, by the way, are the patients getting older and older? I mean, are people coming in for these so-called or smile makeovers? Are they getting older, or is it younger people?
Typically, it's across the board. It can be anybody. Anybody can be more youthful, more attractive, more vibrant with a great smile.
Okay, now you're a dentist, so of course you think the smile is important. How important is it, as you see it?
It's the window to the world. How many times do you walk into a room and you get immediately attracted and say, I want to meet that person, whether it's in a business meeting, whether it's a social situation. They have a nice inviting smile, and they bring you in, they walk you in. You want to go ahead and speak with them.
You know, we talked on the telephone, and we were talking about job interviews. You know, who do you hire? The person smiling or the person that seems to be serious? Or
they present themselves so well with a great smile. It exudes confidence. It shows that you want to be there. You want that position. It's the window to your.
Now I have a lot of questions about porcelain veneers. You know, we're talking about cosmetic dentistry today, smile makeovers, but I always feel like I could spot, and I told you this in the green room, I could spot 15, 20 yards away, veneers.
Yes, the chiclet smile, right.
Okay.
Who wants that? Who woke up this morning and said, ooh, want some big white chiclets on my teeth? Well,
Is that the hands of the dentist?
If you see that, Randy, they're not a patient of ours.
Okay.
Reason being is we want to listen to our patients. We take pride in listening to our patients and telling us what they want. We want them going out with a very natural smile. We want them presenting themselves in any situation, whether it's a business or social relationship, with a lot of confidence, looking natural, and nobody going, oh, where'd you get that done? We want them to say, oh, your hair looks different. Oh, is that a new suit? Okay. Oftentimes, that's what our patients hear. Nobody said anything to me, doctor, about my smile.
People do not like going to the dentist, right?
Correct.
Right?
Who woke up this morning and said, wow, I want to go to the dentist?
Do they say, no offense, doctor, but?
Well, they always say, no offense, doctor, but I hate you. And I go, that's fine. And there's a condition, there's a name for your medical condition.
Yeah?
It's called normal.
It's called normal, okay.
It's called normal. They don't want to be there, but they want us to make them look better. They want to eat at the Thanksgiving table, and that's what we help provide them to do.
But your background in training, you say that you've gotten to, after dental school,
yes,
like 1,500 hours of training.
Probably more. Probably one class a month.
Is that
I
right?
attend. Yes.
Is there that much really to learn?
Yes, there is. It's the smallest of things. And another thing is, oftentimes you get what is called affirmation, where you're just affirming what we're doing is correct. We're at the latest and greatest edge of technology, and what we're doing is spot on. And that's very important too, and my staff goes with me on that.
Now, I saw your photos.
Yes.
Okay, we briefly looked at them. Do you think that it's more art than science?
I think it's a combination of both. I don't really know if you could really say it's this percentage that or this percentage this, but you have to have the technical skills to be able to do it. You have to have the hand-eye coordination to be able to do it. You have to have the ears to be able to do it. Ears? Yes, ears, because you have to listen to that patient. And oftentimes they'll say to a patient, help me help you. What do you want me to do for you? If you could sit in my chair.
Yeah, what do they say? On a cosmetic consult, what do they say to you?
Doctor, thank you. That's the first thing, because the other two doctors I went to, they didn't listen to me.
Okay, what are the different categories then of cosmetic dentistry?
Well, let's start with whitening. Whitening is one of the easy ways to enhance your appearance and make you feel more youthful. Whether you're 30, 40, 50, you're going to that reunion, you have that wedding coming up, you have that reception, whatever it may be, that's an excellent way to make you look very natural and very appealing.
Is that the most popular procedure that you have?
By far.
So we've got whitening, then what? What's the next level up, I guess, of cosmetic dentistry?
Well, oftentimes when we were children, we had black fillings, black or silver fillings placed on our back teeth. And when you're talking in that appearance, that's another aspect.
So metal-free dentistry, in a way.
Correct, where we would place composite fillings that would be tooth colored so that they blend into the smile, blend into when you're talking, and they look very natural.
Are they still doing metal fillings across the country? I mean, do you do them?
Very rarely, yes.
Okay.
Yes, they do.
Even bridges and partials have become cosmetic.
Without a doubt,
nowadays.
Absolutely. Right, because with bridges you can have a non-metal bridge where it's just all ceramic, very natural looking, actually stronger than the metal.
Really? Okay.
Yes, ceramics have advanced with technology, as has the times. Partials can be metal-free, blending in if that's the option that that patient wants to take. And there's also something called invisible braces now, where...
Yeah, what do you call that in your practice?
Invisible braces.
Invisible braces, okay. Yeah. I thought you had a fancy name for it.
The company that we use is called Clear Correct.
Okay,
we love Clear Correct. We have had so much success with that product in terms of just gently moving the teeth side by side and creating enough space where in a short period of time, now typically normal braces, 3 years, lots of wires, lots of metal.
Okay.
Invisible braces, half the time, 12 to 18 months, plastic trays.
A lot of the adults doing this, going for this, adult orthodontics?
Huge.
I mean, for people that can't afford veneers.
Well, here's a way to very conservatively make your smile look better, look healthier, look younger, make yourself more attractive in a very easy fashion. What happens is the patient who's had orthodontics before in their teens, traditional orthodontics, oftentimes when they're in their 30s and their 40s, the teeth shift in the front, on the lower especially, and then they start to overlap. And then you see that crooked smile.
The lower teeth, okay.
The lower teeth especially. And then the upper teeth start to overlap a little bit. And so invisible braces can clean that up in a heartbeat, make that look fabulous. So we would like to see that type of patient in for consultation, because what happens is as you get older, the face becomes a little less elastic. You mostly show your lower teeth when you talk and smile.
Good point, good point. Okay, that's right. When you're older, just the bottom.
Yeah, watch the newscast tonight. You will see mostly lower teeth on the newscast.
Their teeth are showing?
Yes.
And so those
especially
people
males.
Is that your most popular procedure, by the way, just the bottom teeth that have shifted?
That is correct, yes. Very popular.
And
very successful.
Is that right? Now, what about when you hear terms like instant orthodontics? What are we talking about there?
Instant orthodontics would be using porcelain veneers to create the magic of, I have straight, beautiful, wonderful teeth.
So instead of this invisible braces,
yes, which could
going with veneers right off the bat.
Right, invisible braces, let's say, could take 9 to 18 months, maybe 24 months. We can do instant orthodontics with veneers 3 weeks.
And they can look natural.
They do look natural.
Okay, good. Now, you say you're changing people's lives.
Yes.
How so? Elaborate on that.
Well, when a patient comes in and they cry in your chair and they say, I don't go out in public anymore. Why? I hate my smile. I don't like the way I look. If I have to go out in public, I talk like this and I cover my face.
Because their teeth are just so bad, broken down.
Their teeth are so bad and broken down. And when you can take that person and get them to a job interview and then them write you a thank you note, I got this job because I projected confidence because now I have a great smile.
Does that happen really?
Randy, we see it. We see it on a daily basis, whether it's the lady who was recently divorced and is back out on the market again, and allowing her the confidence to go out in a social situation. We see it with a patient who comes in who wants to get a job, and in this tough economic market that exists, they know that they might need an edge and that they come in and they may have crooked teeth, but we see them come in maybe shy, a little.
Is that right?
A little, inhibited, and the next thing you know, when we're done, they're just lighting up the room, and you can just see the transformation in their
Do you really see? I mean, so when they come in for the follow-ups and things like that.
Oh my, they're
acting
absolutely
differently.
They're acting differently. They're projecting more confidence, more youthful appearance. They have bought into their own success.
You brought, I guess you have 4 children.
Yes.
3 of them you brought here to the studio. Great-looking family.
Thank you.
Do any of them want to be a dentist, by the way?
Not at this point in time.
Not
A little too early in the game right now.
Is that right?
Yes.
Okay, good. Okay, so back to, now you brought some photos.
Yes.
Okay, let's take a look. Okay, so what are we looking at? We're talking about cosmetic dentistry, smile makeovers. According to Dr. Bartusiak, small improvements to your smile could make a big difference not only to your self-esteem, your appearance, but how people perceive you. Okay, so what are we looking at here?
Now, Randy, take a look at this woman.
All right.
And what we have here is someone who walks into the door and says, I hate my smile. Okay, well, what do you hate about your smile? My teeth are crooked. I don't like to smile. I'm generally a happy person, but I find myself covering up my face when I talk. Social situations, I feel a little bit awkward, but I'm a very, vibrant people person, but I'm very self-conscious of this.
So once she tells you what, she wants, when you look at that mouth, what do you see?
What I see is a smile that's going to be transformed.
Okay.
I see a smile that has a lot of potential and can be fixed relatively easy. I see a smile with darkened corners in the mouth that doesn't lend itself to a youthful appearance.
Okay.
I see crooked teeth that are discolored. Discolored teeth, as we talked previously, say that I'm aging.
All right.
Let's take the eraser to that. Let's whiten her up a little bit. Let's go ahead and make those crooked teeth straight with some instant orthodontics. Here's a case where
Interesting. And how old is this woman?
In her late 50s, early 60s.
Okay. Now, when you see this, they say with certain artists, do you see her mouth when you look at this before? Do you say this is going to be good? In your mind, do you see?
In my mind's eye, I see the finished product when she walks in the door. Yes.
Is that right?
Yes. In my mind's eye, I see exactly.
Do you
what
get excited sometimes and say, "Oh, this is going to be good"?
Oh, absolutely, because I know that I get to see her 3-4 weeks down the road, and we are completed with that case. How vibrant she's going to look, how happy she's going to be, and she's going to give me a big hug, and we're going to go down Happyville together.
So with her, all you did was whitening, adult orthodontics, which is the invisible braces.
No, we didn't do any. She didn't require that. She didn't want to do any of that. She wanted instant gratification. Boom, done. We did some veneer work for her, and she just said, number one, I don't want orthodontics. Number two, fix it. And I said, what do you mean? She said, fix it. She said, my friends recommended you. You're the best. Fix it. I said, okay. And Randy, when you see these afters, and you look at this before, you're going to say, really? You guys could do that?
Okay.
In a heartbeat? Yes. And
let's take a look. Okay. It's very nice.
What we've done for this patient is transform her smile by attention to detail, attention to the little things.
All right.
You don't see the dark corners of her mouth at this point in time. You see nice, straight teeth that are feminized. They're curved. Females have shape.
What do you mean by that?
There are many subtleties to the tooth, where light reflection, how it protrudes, the lip line, how the top teeth, if you look at the top teeth, how they just graze the lower lip. That's the perfect
Interesting.
smile. That's
Good.
the Mona Lisa of smile.
Is that right?
Yes, exactly.
You seem very proud of this work.
Well, of course. But it's all a part of it. It's the patient. We say in our office, we do our best work on our best patients. This lady was a great patient, very cooperative, very helpful.
So when she sees herself in the mirror for the first time, what happens? Like, what do they say?
Tears.
Is that right?
Tears. Tears, they get giddy, they smile, they can't stop smiling. They're like, I can't believe it, I can't believe it. Because we know, we have in our mind's eye what their finished product is. She hopes she has what that finished product is. She's seen the chiclets that some.
You mean the phony looking veneers?
Exactly.
Hey, you have this thing, a test drive. Take a smile on a test drive.
We always do that.
What does that mean?
Well, 99.9% happy doesn't cut it in our office.
Okay.
Here comes the perfectionist part.
Okay, all right.
So my patients know they have to kind of deal with me on that. 99.9% isn't going to cut it. Why? Unless you're 100% happy, we're not 100% happy. So if somebody gets a smile makeover such as this, what we have them do is we have them test drive it. We put everything in.
Do you use those words?
We use those words, test drive.
Okay.
You go ahead, you wear those, we'll put them in with some temporary cement. They'll be secure enough that you can be in any situation, socially or business-wise, that you can go into, but you get to test drive.